And in his mind, he believed that if he walked away and they disappeared, it means they were really gone. And this is a 10-year-old child. Do you know how long it took him to walk that 20 feet? A good 45 minutes. And that 45 minutes was like pulling teeth. He threw temper tantrums, he would kick and scream, and all I could do was encourage him that his parents are still going to be there. Of course, that's kind of like reassurance seeking at that point. I'm reassuring him. However, my goal was to get him to walk that 20 feet away from his parents. Okay? So, let's differentiate some of these specific symptoms. The OCD child may keep to himself because of his fears. So for example, like the kid with the booger. I wouldn't want to be next to any kid with boogers or slimy snot or anything else. So I would keep to myself. You would too, right? If you had contamination fears. The other thing is, kids don't want other kids to know about their anxiety. So they try to keep it as contained as possible because they're afraid, number one, that other kids will trigger their obsessions. And number two, that if they do experience that, other kids will know and they'll be embarrassed. Okay? They throw temper tantrums. Anxiety children throws temper tantrums, not just to get their way. Usually, it's because of the discomfort that they experience and they don't know how to express that. They can't say, sometimes they don't even have the words to express, I'm feeling jitterbugs. I'm feeling tingly sensations in my skin. They don't have those words or even those experiences. And sometimes they may think, that's kind of weird. Why would I be experiencing this? And therefore, they keep it to themselves. Okay? They refuse to comply with requests and rules because they need to comply to their OCD rules. Not because they're purposely disobeying your rules. However, they have to wash 10 times and they can't follow your rules of just washing once and be done and over with. Okay, so because they have to comply to their OCD rules, sometimes, most of the times, that rule is going to be in conflict with household rules. Okay? Frequent outbursts and anger due to resentment, because again, with the child that I just spoke with, his parents made him go to school. And he wasn't able to verbalize that he was feeling uncomfortable and he had fears of him being kidnapped or his parents being in a car accident. So he felt resentment toward his parents because you are their role models and they go to you for comfort. And if you are going to make them go to school, guess what? You're doing exactly the opposite of what your role is doing. So in a way, you're kind of in a bind. Okay? And if children understand why their bodies are experiencing what they're experiencing, just like when I explained the fight-flight response to you, then a light bulb comes on and, oh, well, I get it. Yeah, my heart rate goes up and I feel pins and needles, and that's the reason why. So then it normalizes their experience. Anxiety is okay. It's just that we experience it at a wrong time. Okay, not necessarily when there's a real saber-toothed tiger. They have difficulty paying attention. Not because they just can't pay attention, because they're ruminating. Imagine your missing child. If you're ruminating over the whereabouts of your child, would you be able to pay attention? No, it doesn't mean you have ADHD. Okay? Low frustration tolerance, easily annoyed by others. Can you imagine you're worried about the child and someone asks you, where's the milk? And then followed by another question, where are the eggs? Can I sit in this chair? Are you going to have the tolerance for the questions or for other people's annoyances? No. Doesn't mean you're oppositional, defiant. Okay? Gets behind in work. Usually it's because of their worries or because of their compulsions. Having to read and reread and reread and reread just until it gets right, or to make sure I didn't get anything wrong. Writing and erasing until it's perfect. That takes up a lot of time. Okay? Saying mean, hateful things when upset. I want to shoot your head off. He didn't really mean that. If he did, you wouldn't have his fears of his parents, something bad happening to his parents, right? He said that out of resentment, which is different from a true oppositional defiant child, okay? Has low self-esteem. Well, you know, if you're suffering from anxiety and it's interfering with not just your school, however, your social interactions, no wonder you're going to have low self-esteem, okay? Because number one, you're unable to manage the anxiety. Number two, if you think there's something wrong with me, there's something wrong with me because I have to do these compulsive behaviors that seem silly. Of course, your self-esteem is going to be compromised, okay? Spending an inordinate amount of time on homework, again, because of the compulsive behaviors. Not because they just can't pay attention or their mind is wandering all the time. However, because they're repeating and repeating and repeating, or because they're ruminating over those fears. Hostile when irritated. Again, that is because of the resentments that they experience towards family members. Talks about world events because, again, their worry antennas are up. They're going to search out as much information as possible from their environment. So they're going to know a lot of stuff, especially dangerous stuff. Did you feel that earthquake this morning?
No.
I thought I was back in Los Angeles. It was a 3.7 earthquake. And the bottom line is that whether you're actually ADHD, have OCD, or oppositional defiant, the child is not reaching their learning potential. And this is where we need to involve the schools, and we'll talk a little bit about that later. So now you got all this information. Now what? What do we do? Well, I'm going to talk a little bit about how do we do exposure and response prevention with a child with OCD. It's a little bit different. How much time do we have? 10:45, so we have about half an hour. Okay, excellent. So the first thing we do with children, and those of you who have children who are here at the conference, we're actually have a talk after this, actually a workshop with kids after this about this, okay? So the first thing we want to do with the kids is I want you to name the OCD monster, okay? And for example, it's got to be a name that makes sense. So if Charlie doesn't mean anything, you're not going to name your OCD monster Charlie, okay? Let me give you an example of what my OCD monster's name was. It was the Cookie Monster from Sesame Street. I hated the Cookie Monster. It freaked me out. So every time that I was getting those images, I would think about the Cookie Monster. The Cookie Monster is putting these images in my mind. And every time I gave the Cookie Monster what it wanted, if I followed the Cookie Monster's rules, such as I could wash this way, I just gave it a cookie. every time it gets a cookie, it's going to get bigger, right? And it's going to be more powerful each time I give it a cookie. So what do? I purposely don't listen to it. I disobey its rules. And by doing that, I'm withholding the cookies. And the Cookie Monster is going to starve and be smaller and smaller and smaller. You have to remember that children, they have wild imaginations, and they are so creative. And the goal is to tailor the treatment so that it fits with their imagination and their creativity. And kind of make exposures a little bit more fun than just going and touch toilets for absolutely no reason. Okay? So what I do is I ask the kids to come up with a name. And then describe it, just as I've described the Cookie Monster. And then draw it. Okay? One of my kids, and when I treated him, he was 7 years old, he called his Cookie Monster, he called his OCD monster the Kraken. I had no clue what the Kraken was until he taught me. A 7-year-old taught me what the Kraken is. And what he was saying was that the Kraken has all of these tentacles, and it's pulling me apart. So every time he drew the Kraken, every time he came back to session successful at breaking a compulsive behavior or breaking a rule, we chopped off one of the tentacles. And eventually the Kraken just became this squishy ball. Okay, so you have to use the child's imagination and play. Again, it's very important to find a therapist that works with children and can use the child's imagination and their creativity as a tool in treatment. The important thing is to model the creativity with the child, okay? So some of the so we want to label OCD and setting up the good guys versus the bad guys, okay? So the OCD is the problem, and we're allies. We're in the team with the child to fight the OCD monster. I had a little girl, she was actually my youngest patient, 4-year-old child, who always wanted to be a princess. So we set up this scenario where she's a princess in the castle. And her OCD monster, she called the OCD Boo-Boo. And the OCD Boo-Boo was the guard of the dungeons. And any time she followed the OCD Boo-Boo's rules, she was literally following it into the dungeon. And when she was able to break the OCD's rules, she was able to break free from the OCD Boo-Boo's dungeon. Pretty creative, huh? So we want to have the child understand that OCD is the problem, not them. They are not the problems. OCD is the problem. The OCD monster is the problem. It's a neurological problem of the brain, okay? Not them. So we have to, and as parents, we have to remember that as well, that when your child is throwing tantrums, it's because they can't contain the anxiety that they experience. And it's not them. It's a neurological problem of the brain, okay? So when a child is engaging in the compulsions, or they're trying to resist, yet they're, I can't do it, I can't do it, I can't do it, it's really powerful. Then one of the things that you can ask them is that really true? Or is the OCD monster just playing tricks on your mind? Because usually that's what's happening. How often has the OCD monster been accurate about your fears? When you go wash, does that really solve the problem? The OCD monster will say, oh, Johnny, all you need to do is go wash. You'll feel much better. Is that what really happens? Maybe for a short while. However, over the long run, your hands are raw, they're bloody, they're dry and cracked because you're washing. So is the OCD monster actually helping you? No, it's playing tricks on your mind. And oftentimes, I have parents role play. So parents pretend to be the OCD monster. And the child, if they're playing themselves, little Johnny's playing himself, and you're battling verbally. Then I reverse the roles. Have the parents pretend to be the child, and then the child pretend to be the OCD monster, so that the child has practice of what it's like to battle the OCD monster. And you want to always reinforce that their fears are inaccurate. It may feel like it's dangerous. It may feel like you need to go wash. However, it's not actually the case. Okay? So you want to use some logic, as much logic as the child can handle. How many of you have children who seeks reassurance? Okay. When I first tell parents this, they're shocked. Okay? The very first thing you want to do with little Johnny is first entertain the doubt with vagueness. Am I going to die? Maybe. I don't know. Is this cereal going to kill me? It might. I don't know. That's exactly what you want to do. Now, here's the thing, though. You don't just respond in that way after you've responded many years with the reassurances. You've got to prepare the child first, okay? Because if not, they're going to resent you, and that's not what you want to do, okay? So you're going to prepare the child first, first with the psychoeducation, and have them understand that the reassurances are really compulsive behaviors. And what do we do when we follow the OCD monster's rules? It will get bigger. So we're not going to follow it, which means that mommy and daddy are not going to respond with the correct answers. That's the first thing you do. After the vagueness doesn't work with them anymore, and they continue to seek reassurance, such as, am I going to die? Yes, you're going to die. Well, the truth is we're all going to die, it's just a matter of when, right? However, with the child, yes, you're going to die. Is this cereal going to kill me? Yes, it's going to kill you. You respond to the absolute absurdity. And this is the reason why. It may sound harsh and insensitive. However, the child is always going to be thinking about that anyways. So by responding to the absurdity, what you're actually doing is you're, number one, increasing their awareness of how silly their question is. And number two, you're basically telling them that you're not going to get the right answer out of me. So you can ask all you want, because you're answering to the absurdity. Okay? Again, we want to reinforce the idea that we are allies to beat the OCD monster. So we are not being insensitive parents. We're actually supporting the child without supporting the OCD monster. Okay, that is your goal, to support your child, not the OCD monster. Of course, if we're going to be insensitive, we need to also be extra sensitive. We need to give them praise for resisting the OCD. Even if they're able to delay the response, we need to give them praise for that. Well, it's great that you're able to hold it that long without washing. Okay? Because praises work wonderful for children, especially if their self-esteem about their own abilities is so low. When you praise them for the accomplishments, even the slightest accomplishments that they make, it feels good. And it makes them feel like, I can do it. It empowers them. So compliments and praises are absolutely necessary in this battle against the OCD monster. We also use behavior modification to get the child to do their exposures. During session, I have this little girl who every session she will throw tantrums in the beginning. I remember the very first evaluation. It was 2 hours of non-stop tantrums. She may stop for a little while, and then as soon as her motor starts running again, she'll go at it again, kicking and screaming. Literally kicking and screaming. Okay? So what we did was we developed a reward system that if she is able to make it through a session without kicking and screaming, she gets pizza afterwards. We went in group therapy. When kids come in with their homework complete, they get cookies after group. So we do use behavior modification to encourage kids to engage in their exposures. You can also give bigger rewards, such as extra playtime, extra time on the Wii, extra time on the Xbox. However, of course, the bigger rewards means that they need to make bigger accomplishments. Okay? So, how many of you have worked with your child's school? Okay. And have they been receptive? That's wonderful. I don't always hear that though. Most of the time I would hear that the schools are not receptive. One of the kids, we did a in-service with Dr. Paxson. We did an in-service at his school because his teacher was so insensitive that he would tell my kid to go to timeout when he couldn't resist the compulsive behaviors. I think he was so insensitive that he would even put attention onto my kid in front of the whole class and made him look silly in front of the whole class and belittled him in front of the whole class. So of course, when Mom called me about this, I got upset. And we called the school principal, and we did an in-service at the school where she gathered all of the staff members, and I basically lectured them about what OCD is. Just like the example with the missing child, so that they understand. The goal is to get them to understand, educate them, and get them to understand what is the process of OCD. So this is very necessary if your child is in a school where they're not understanding of OCD, and especially if they're responding negatively, such as belittling the child. You can always get material, especially from the IOCDF, and give it to the school so that they understand this is what OCD is. Okay? And it's important to follow up, even after you have your initial consult with the school, to follow up with the teachers and make sure that whatever plan that you establish with the teachers is working. Because if it's not working, then it needs to be tweaked. Okay? And definitely involve the child's therapist. That is necessary. Because the child's therapist knows, I hope, knows what compulsions are we working on at this time. So, you know, if we're not working on hand washing just yet, then the child is allowed to go wash until we're working on that. Okay, and teachers need to understand that. That's just the same, if you don't let the child wash when we're not working it, it's the exact same thing as you can't call the police when your child is missing. How does that feel? When you haven't agreed to it. Okay? And these are the examples that you have to help teachers and school staff understand so that they can feel the empathy for where the child is coming from. Okay? So these are some of the coping strategies for you, which you do have a list of them in the back of your handout. I know a lot of these guidelines are a lot easier said than done. However, it does take patience and it does take working alliance with the child and the therapist in order to incorporate these. Okay? So first thing, be cool. Use a calm manner. And if you react in frustration, it's only going to breed further frustration. Not only within yourself, however within the child and the situation as a whole. So if you need to take time out for yourself, do that. Take time out for yourself. If Johnny is throwing temper tantrums and you need to turn inward and shut down for even that 10 seconds, do it. Because that temper tantrum isn't going to stop. So you might as well just shut down whatever it is that you need to shut down, even for that 10 seconds, so that you can recollect yourself to respond in a positive way. So you want to speak clearly. And when I say clearly, it really means that if you and your child are in an alliance, you need to communicate what we're going to do. So if a temper tantrum does occur, after it occurs, process that. What happened there? What can I do next time to be supportive to you without supporting the OCD monster? So that you are on the same page and you understand how to respond. That is actually giving you weapons, giving you tools to beat the OCD monster next time around. Because the OCD monster isn't going to go anywhere. Okay? So you might as well get your artillery out. Adjust your expectations. Again, your child didn't get into the compulsive behaviors overnight. It's not going to go away overnight. And it's important to work with the therapist, because if the therapist is not working on that specific compulsive behavior at that time, then it will be unrealistic for you to expect that the child don't wash his hands. Okay? So adjust your expectations. And never, never, never compare your child to anyone else's. Encourage your child to refocus his or her energy into positive, enjoyable activities. If that means extra me time, okay. Unless they're playing like hours and hours and hours a day, okay, that's a little too much. Okay. However, to get them to refocus onto another activity, it means to take the focus away from that yellow dot. Okay? And that's essentially what you want to be able to encourage them to do. Also, redirect your own energies so that you're not always focused on the OCD too. You don't want your life to be just about OCD, OCD this and OCD that. You know, it gets a little bit overwhelming, not just for yourself, however, for your child as well. So refocus your own energies into something positive as well. If your child can't stop washing, that's an example, or can't stop doing whatever compulsions, turn an eye, turn a blind eye. Okay? If that's not what the therapist is working on for that week or that day, then don't pay too much attention onto it. Okay? Because it will only create conflict and resentment. And go about your business as usual. Don't focus too much energy onto the OCD. That's a given, not being judgmental of your child's behavior. If you have the understanding of why he's behaving the way that he's behaving because of the anxiety, the discomfort, then you'll understand and it won't need judgment, right? of you have children who have difficulty making decisions? And then how many of you, because of your own frustration level, make the decision for them? Do I want bacon or turkey? Bacon or eggs? No. Bacon or ham? See, I can't make a decision. And then you go, well, since you can't make up your mind, you'll just have ham today. Yeah. It's more like if they can't make the decision, then they don't get anything. Okay? Or they have to make quick decisions. Sometimes what I do is I purposely have parents give patients options, give their child options. So rather than making a decision for them, what do you want for breakfast this morning? Now you don't want it to be open-ended to start with. You want to give them, start with 2 options. Okay, cereal or French toast. And they have to choose one quickly, within 3 seconds. Okay, of course, you have to talk about this beforehand, before you pump it out on them. Okay? And then when they're able to make the quick decision with 2 choices, expand it. Now do 3 choices. And then eventually make it open-ended. Okay, so you want to do it gradually. Ignore what you can't change. That's the same thing as turning a blind eye. You cannot control their thoughts. You can't even control their behaviors. Only they can control their behaviors. So why get upset over something that you cannot control? Let it go. Okay? Again, making reasonable demands, that's the same thing, to adjust your expectations. You can't expect them to do something that, number 1, you haven't talked to them about, and number 2, that they're not working on just yet. So make reasonable demands. Do not pressure them to stop their compulsions, and just stick to the task that's assigned by the therapist. If you pressure them to stop their compulsions, it's going to create resentment if that's not the agreement that you've had. Okay? And even though you are, well, the important thing is that you want to communicate this clearly with them so that whatever limits and boundaries that you're setting up us against the OCD monster, you're discussing this beforehand. Before you can't just, in that moment when your child is having a temper tantrum, to just decide, well, now I'm going to do it this way, because Dr. Gibbs said so. Okay, you've got to work it out in agreement with them beforehand. If your child is engaging in violence and suicidal threats, you have to pay attention to that. Usually, you know, even if you don't believe they will engage in it, you have to give them the help that they need. Okay, so never ignore suicidal threats or any type of dangerous situation. Jumping on top of his father's car was a dangerous situation, and we had to make an agreement that that wasn't going to happen again, and give him tools in how to release his frustration, and give his parents tools on how to contain the situation if that happens again next time. So never ignore such behaviors. And oftentimes with our older kids, because anxiety is so uncomfortable, they may resort to drugs and alcohol to reduce that anxiety. When that happens, it will actually only make the symptoms worse, because drugs, alcohol, and some drugs are downers, such as marijuana are downers. What that means is when the substance is coming out of your body, you're going to be on an upswing, which means more anxiety. Okay, so if they are resorting to alcohol and drug abuse, then that needs to be paid attention to. In fact, we don't treat patients when they are abusing alcohol or substance. That needs to be paid attention first before we do exposure therapy. Okay. And last but not least, solve the problem step by step. Handle one thing at a time. I know that it may seem overwhelming when so many things are happening at the same time. However, you only have the attention span to focus on one thing at a time. So, have an agreement with your child to just work on one rule. Let's just work on one rule for these X amount of days and see how that goes. And if you're going to do that, then ignore the other things that you're not working on. Don't have the expectation that they're going to completely resist all compulsive behaviors or not throw temper tantrums at all. Okay? That's it. Do we have questions? Yes.
When doing the exposure response therapy, I have a daughter who wouldn't walk down the hallway unless the light was turned on. Her anxiety was something was going to happen to her if she walked down the hallway if the light wasn't turned on. I got impatient with it. I ended up taking the light bulbs out of the light. During the day, there's lots of sun that comes in that room, so even though she turns on the lights to walk down the hallway during the day, that day that the light bulbs out, she turned on the lights, but she didn't pay attention to the fact that the lights didn't come on. She was walking up and down the hallway. As the evening came about, and she turned on the light to walk down the hallway, she realized that the lights weren't on. And I just told her, I said, oh, it's been that way all day. I said, the lights haven't been on. I said, you've been walking up and down the hallway all day, and the lights have not been on. And she sat there and thought about it for a second, and then she decided she couldn't walk down the hallway. So all that evening, she didn't walk down the hallway the next day. It actually led to her bedroom. So she couldn't get to her bedroom to change her clothes or anything like that. Well, after probably about 24 hours, then she decided that she was going to walk down the hallway. I didn't even talk to her about it anymore. I just kind of left it alone. Ignored the fact that she wasn't going down the hallway, that she wasn't changing her clothes, that she slept on the couch. So we didn't talk about it anymore. But then she did go down the hallway.